Hey everybody, it's Dr. Davis here. Today's episode, I want to talk about non-surgical or kind of cutting edge techniques that might be helpful for treating a rotator cuff problem. So in the world of orthopedics, we see kind of two ends of the spectrum. On one end, we will see people that just have an inflammatory problem, tendonitis or bursitis, something like that. And we can usually manage that with medications or injections or physical therapy. On the other end of the spectrum, we see people that have a torn tendon. So they usually end up needing surgery in order to get full relief, pain relief, strength, flexibility, all of that back to normal. Unfortunately, there are some people that are in that middle area where they may not get complete relief with the medications, but surgery seems to be a little bit more invasive than what we might hope that we could use. And so people are constantly trying to develop new treatments that can help that middle area where it's more than just medication, but it's not as involved as surgery. And two things that I hear frequently are platelet-rich plasma, or what we call PRP, in the kind of the orthopedic world, and then stem cell therapy. And I see ads on social media and on the radio and in print magazines and stuff, and unfortunately a lot of that stuff is not really backed up by good science. One of the challenges of being on the cutting edge of any kind of new development is that it doesn't always work. And so while you may discover something new, there is a high likelihood that it's not going to work also. So you have to understand those risks before you jump into that sort of thing. Now, sometimes that is not as big a deal, so taking some risks is reasonable. So let's talk about platelet-rich plasma, for instance, PRP. The way that's done is you come into the office, get blood drawn, just like if you were getting any kind of blood work or an IV started, and then you take that sample of blood, you put it in a special machine called a centrifuge where it spins around, and that separates the blood into its individual components. And the part that we actually want is the platelet plasma portion. And so by making the machine spin a certain way, we can isolate that section. You pull it back off, and then you inject that area back into the patient's body at the site of the problem, and that can induce a healing response. So that's fairly straightforward. There's not a lot of risk to that. Kind of worst case scenario, it doesn't work. Or you may have some pain at the injection site, but it's not that big of a deal. The kits, the disposable portions of that can be somewhat expensive, and so sometimes you're talking about a few $100s to do that sort of thing, but it's not extraordinarily expensive. Stem cells, on the other hand, are a little bit more involved because there's really only two good sources for stem cells in humans, in adults, and that is either the bone marrow, which in adults is primarily found in the bony pelvis, or they have found decent quantities of stem cells in adipose tissue, fat. And so the only way that you can really get adequate quantities of stem cells for any kind of meaningful treatment is going to either be to do a bone marrow aspiration, which can be very painful, and typically to do that requires going to the operating room. So you have anesthesia, you have costs of going to the operating room, you have the procedure, and then you need the special equipment to separate the stem cells out of that bone marrow, because you can't just draw the bone marrow out and then inject it somewhere. So you have to separate out the stem cells from that. So that requires some specialized equipment, and then you inject it into the area that you're trying to treat. So that can be pretty expensive. I know a couple of groups in my area that are doing it, and they're charging $5,000 to $10,000 for that sort of treatment. You can get stem cells from another person, but there's some risk to that. There can be diseases that can be transmitted, and that's still expensive because that person had to go through that process to get that bone marrow done and isolate those stem cells. So using stem cell allografts, which is from someone else, can be even more expensive. You avoid the pain and the invasiveness of having your own bone marrow taken, but you got to pay for it with somebody else doing it. Or the adipose source of stem cells requires, basically it's like a modified form of liposuction, and that requires some very specialized equipment to pull those stem cells out of that adipose tissue. And so that can be pretty expensive. I don't think it's quite as painful as the bone marrow approach, but I don't know how reliable it is either. So those are really the only sources of stem cells. The problem that I have with it is when you look at research on it, stem cells don't work any better than platelet-rich plasma, and oftentimes don't work any better than a simple cortisone injection. So in theory, these sound like good treatments, but there's not a lot of proof that they work. So before I don't recommend people go throw thousands of dollars away. But when people ask me about it, I say, I think it's a reasonable choice, but realize that you're in uncharted territory. There's no reliable evidence that these treatments work. And so if you've got two treatments available, one that's a few $100s, another that's a few thousand, and you don't have any reason to suspect that this one is better than this one, then why would you choose the more expensive one? Why would you choose the more invasive one? Why would you choose the one that requires a lot more specialized equipment than something that you can easily do in the office with little risk and a fraction of the cost? So if you are interested in those sort of treatments, I would recommend probably platelet-rich plasma before doing stem cells, just because I haven't seen enough proof that the stem cell stuff is better.